Hello, my name is Craig Dial. Welcome to Rad Exchange. And I've been asked to talk about what is an orthodontic image portfolio. This is something that we do in our imaging centers every day and for beam readers. So I'd like to take a few moments to explain what this is. When you talk to your staff about taking a full mouth set of x-rays, and you say, please take the full mouth x-ray, and they hand you back a bunch of films that are upside down and backwards, that's not really what you're thinking. You want them to be organized. So a full mouth dental x-ray, in a way, is a basic image portfolio. And to put it down to the simplest terms, a full mouth image portfolio is an organized set of images where all the films are laid out correctly, the dots are facing the right way, it's labeled with the patient name, the date, and the doctor name, maybe the age of the patient. And we also have the left and the right markers put on there so we know what side's left and what side's right. And the full mouth image portfolio is laid out in a way that is displayed for diagnosis and patient education. If the films are scattered upside down and backwards, it's not really giving us the information that we're looking for. If we think about a orthodontic portfolio through cone beam CT, we can take many projections of the face. Here we have a series of coronal, axial, and sagittal views of the jaw. And we might be able to produce hundreds, if not even more than hundreds, of images for the cone beam CT. But this is not what an orthodontic portfolio would be. This is a scattered amount of information that's not telling us the details of the patient's condition. So with orthodontics and the case that we're talking about, we need a case-specific image portfolio. And this is really what we talked about earlier. It's a customized selection of images. And for orthodontics, it's a precise display of information. We want to make sure that we give you enough information to explain the case, but not overload with a lot of unnecessary projections that aren't going to give you the information you're looking for and have to walk through. So the case must be concise and complete. And this is relevant information specifically to that case to aid the radiologist in their radiology reports and the referring clinician, and also helping the patient understanding their needs. So when we talk specifically about an orthodontic scan and image portfolio, we have to understand the goals of our scan. And we need to have the cone beam CT capture the area of interest. In this case, it might be from soft tissue glabella, tip of nose, chin, the ear canal, sella. We need to capture the entire area of interest. Often we use head position as a natural head position, just depending on what your particular needs are. And we want to correctly use the right scan protocol. I have another video that talks specifically about scan protocols and which one to choose. So you may want to refer to that. After the scan has been taken, it's very important that the scan volume is oriented to the patient's anatomy so we have everything lined up correctly. And once we've reached our imaging goals, we generate image projections from the volume. Typical orthodontic records include lateral PSF, panoramic, TMJs, and airway. But based on individual cases' needs, we may also want to include any type of disease that might be affecting the patient's jaws, teeth, and airway, impactions, cross-sections, and possibly 3D viewer software. So here we have a regular case that I will show you for a typical orthodontic image portfolio. This one was done in our imaging center. So if you upload your own photographs to beam readers, we'll mount them into an 8-mount series, such as this one that you see here. And then we generate a orthogonal lateral cephalometric, which means that the rays are parallel through the computer, and there's built-in magnification of 0%. We use a 100mm bar to measure the true size of the patient's head. And we also customize the section to show sella turcica and other anatomy. We do a cephalometric analysis. We'll go ahead and trace all the structures, and then we'll do an analysis based on your individual doctor's needs, such as a Steiner-Witz, Jerabak, or whatever customized analysis that you'd like to have. Also included in this would be a frontal projection, and often it's much better evaluating asymmetry with frontal projections. And I've asked an orthodontist why they like the frontal, and they said to me that many asymmetries were maybe undiagnosed with conventional imaging, leaving the orthodontist at a loss of why the case didn't work out. So sometimes asymmetries are difficult to see in conventional 2D, and here we have a great projection. We also eliminate the vertebrae in this projection, so we just get the teeth and jaws. A panoramic is generated based on the curvature of that particular patient's jaw form, so we just get in focus the teeth and the jaws. We don't have the hyoid, superimposition of structures, airway, anything else that's going to interfere with our understanding of how the teeth are behaving in the jaws. And then we go ahead and create another panoramic and have this tick millimeter line that's on the bottom. And this is cross-sectional imaging every millimeter from end to end of the jaw. And we're trying to make sure that we can rule out any kind of pathology or disease within the jaws. We want to see if there's detection of any root resorption on the labial and lingual aspects of the teeth. We want to know if there's any thin avulus within the jaw and evaluate any impactions that might be happening in the jaws. So we typically will section the jaw from end to end, just so we can see the health and conditions of everything that's going on there. TMJs apply to a big important rule with orthodontic treatment, and early detection of DJD could really be an eye-opener about how much change there could be on some cases. The orthodontists tell me that if the patients are treated early, or at least diagnosed, the patients can be informed of potential future problems. So we routinely do TMJ projections in our ortho portfolio. Airway issues. Airway obstruction plays a big role in facial growth. Early detection of narrow or compromised airways is critical for orthodontic diagnosis and treatment. We created this page trying to understand the limitations of the jaw of the airway, find the overall cubic millimeter airway volume and the minimum axial airway, and colorize it and place it to a chart based on patient age to see how they might fit in. And for those of you that have a 3D photographic camera, such as our imaging centers, we'll go ahead and superimpose and fuse the cone beam scan with the 3D photograph, so you get a superimposition of those two files. Now that's a basic orthodontic image portfolio. If the patient has any incidental findings, we'll add more information to the case as needed. So in conclusion, the orthodontic image portfolio helps explain the story to the patient and to your referring doctors. The patients can understand and better appreciate the concern and their conditions. And is a customized, specific collection of images to that specific patient's case. This information is relevant to aid the radiologist and the orthodontist and your dental team. It may also need to have several software platforms to achieve the goals. The images that you saw in my portfolio required several different image platforms to get all the information extracted. And other notes, portfolios may also include the DICOM data, third-party software viewers, such as maybe Dolphin Imaging, and we might also import 3D movies, save them as PDF documents or JPEGs. I want to thank you for your time, and if you have any questions, you're welcome to give me an email call here, and I appreciate the time. Thank you.